what knowledge we need to look at. What knowledge right now, the strengths is where are we now? What knowledge, what strengths, what practices and resources do we have now that will help make us sustainable and help us to evolve? So with that said, anybody want to start the conversation? Anybody? Bueller's not out there today.
I'm shy. It's Jonathan Fight. I'll
okay,
start.
Go ahead.
As anyone who knows me knows, I don't really ever have anything to say. The strength is, I have seen, and I think this is across emergency services, whether you're whatever color your patch is. I have not found, and I'm a relative outsider to this business, I've never run on the line. I work on the technology side, right? There is only one organization that I can think of, which is the United States Armed Services, that has more power to generate awe among the observing public than fire and EMS when you're walking down the street wearing your dress uniform. There is an enormous amount of respect. There is, as you know, and everybody talks about how the relationship between pre-hospital care providers, both fire and EMS, as opposed to police, for example, is the police inspire fear, right? But the fire and EMS services inspire awe. And that is a power that this industry does not use effectively. In fact, to the opposite, I think we spend more time as an industry tearing each other apart with different types of tribal colors. Fire versus EMS, public versus private, private versus hospital, hospital versus whatever, BLS versus ALS. It's very much us and them. And if that were to change, there is a remarkable amount of force that can be brought to bear. So the second part of this, which I think is the opportunity not only for the immediate conversation, but is changing. And Tony, I'm glad you used the word evolution. I think it's an important one. Is when is the last time that anybody tried to truly break the economic models underpinning fire and EMS? Right, there was a conversation that persisted yesterday around the question of whether pre-hospital care in its various forms should be publicly or privately funded in light of everything that's going on right now. And the problem is there is still payment tied to transport. ET3 is going to be a remarkably complicated chimera anyway, but it's still kind of baby steps toward a new payment model. But when is the last time anybody sat down and said, what is the actual value, economic, pay for it, give you a check to say, thank you for a job well done, here is the payment you have earned? When is the last time anybody did that for fire and EMS? And it turns out there's one guy in California, and actually since Michael said he's in Sacramento, so I'll point again to there. This gentleman is actually a battalion chief, I believe now, on the Sacramento Fire Department. His name is Eric Sailors, and he has become kind of a go-to guy for doing this inside the fire service, not per se EMS, but on the fire side, looking at the economics of a building saved. Because it's not about the construction cost of the building. It's about all the things that building can do, right? What is the value of being able to continue operating the business that was once in there? What will the long-term value be when those people who own that business are able to send their kids to college, right? Because their business didn't literally go up in smoke. Those types of analyses help provide an economic underpinning for what everyone on this call does. When is the last time anybody tried to undertake that same calculation for EMS? And if anyone were to do that, then all of a sudden the conversation starts to change from what is the value based on cost of transporting you to a hospital, right? The entire CMS cost accounting exercise goes out the window because cost doesn't matter. Value achieved matters. And that is not something that this industry does offer.
Jonathan, you have to be deemed essential first.
No, you don't. Again, I mean, that's not true at all. Because again, let me ask you the question: what is the value of a sandwich? I mean, sandwich isn't essential. Exactly. But a sandwich isn't essential. A sandwich could be swapped with something else. The question is, what's it worth to you? And until you have the I mean, again, like take you know, if you want to use something not so sort of vulgar as a sandwich, how about a car, right? I mean, gets you to and from work. Can you work from home? Well, it's been interesting, right? Before this exercise of people living and working in their houses under quarantine, there were many industries that essentially said, you can't work from home. It can't be done. We have to be in the office. Well, therefore, I needed a car in order to get to and from my job so I could make my money, so I could pay my bills, so I could raise my kids, and yada, yada, yada. And all of a sudden, this exercise has challenged the very reality of how we work. I think that's actually maybe one of the lastingest impacts of the coronavirus crisis. The way we work has fundamentally changed, right? So essential or not essential, politics aside, the question is, when is the last time anybody tried to say, this is what is the value of what we do, divided by the number of hours we spent or the number of people who do it or whatever it is, to come up with a price tag that says, this is why our juice is worth the squeeze. And I don't know in 10 years that I haven't heard, quite frankly, anyone other than myself, and to some degree, Eric, it's certainly Eric on the fireside, try to describe the work that we do in those terms, because it's hard to think about, right? It's hard for people to look at their work and say, well, what is my value? But the fact is, it's actually really high. It's just a hard calculation to do. But if this seems like a perfect opportunity to bring together some thinkers and spread that idea around to say, what if we had that conversation and we reject the idea that we have to get paid by the mile? Instead, let's get paid by the task achieved, which may end up being a significantly higher amount than you get paid by the mile.
Jonathan brought up earlier about, comparing fire and EMS to the military and how they function. And I don't think that's a bad. Anybody disagree? I think that's a comparison as we go through this whole process to see how they weather through strengths, weaknesses, opportunities, and threats, and continue to evolve into a modern day. It's not just a fighting force. I mean, the military provides all kinds of services, and we would, even if they didn't fight another war, if we did away with the military, we would have severe deficits in being able to respond to issues. And one of these things that I look at this COVID-19 problem is that we planned it, because I did out in Saipan work on a project where we did an exercise for moving the stockpile to Saipan to do a vaccination, to train. And that's when I noticed that we're planning to do things in a small area. We weren't ready for an expansive issue that covered the whole country. But if you look back to the Spanish flu, we already had examples of where we should have been prepared. And I think the military is flexible. And one of our strengths should be in the future, out of opportunity, is how are we a flexible force to move to the opportunities and the needs as they come along.
Can I jump in on that?
Absolutely.
Okay, so because I think there's a couple pieces that you just mentioned, and who spoke right before you? I'm sorry that I lost track.
That was Michael.
All right, perfect. So two pieces there. I want to come back to the community paramedicine thing in a minute. So if I forget, remind me. But I think it's apropos of what you're trying to do here, and let's talk about that. But what you mentioned about the military as sort of a ready force, and I think it's a perfect point that you've made as far as sort of being, the Swiss Army knife that can kind of be deployed in a variety of different ways, right? But the part that I was highlighting there about military also came to me from some folks at the Tucson Fire Department in Tucson, Arizona, where there were two folks who I met when I was down there that were both former military. And they asked me why I think basically, why does EMS and fire have trouble getting to the level of cachet that the military does, and why do we have the political problems that we do? And it ultimately came down to culture in a way that this industry does not respect. And again, when you think about, for example, the associations fighting associations, I'm going to vent a little bit here on this. Because I think when you talk about, again, police have their own issues in the political eye and the public eye, but when you talk about the police force, their association is called the Brotherhood, right? It's not the association of police. It's the fraternity. It's the brotherhood. It's the benevolent association, right? They use words that are incredibly powerful from a unity standpoint. And if anybody is on this call is military, I would challenge you to push back on the following thing I'm going to say. I think the organization that gives the Marines the biggest crap is the Navy, right? And the Marines give the Navy crap, and the Army gives the Air Force crap, and the Air Force gives the Army crap. But if you're an outsider talking about the United States Armed Forces, by God, you talk about any of them and you're talking about all of them, right? Internally, they can give each other whatever shit they want. But from an outside, they are one family. And this industry does not do that, right? So from a cultural perspective, the military has a culture, right? They have a command called TRADOC, right? The Tradition and Doctrine Command. And EMS does not have that. The fire service sort of has it. I mean, again, there's basically one main association for the fire labor, and there's one main association for fire management, right? IAFC and IAFF. And EMS has one for lobbying and one for education and one for management. And some places like Oklahoma have 2 or 3 different associations. Then there's the private ones and the public ones, and they kind of tear each other apart with this weird tribalism. And there's been a couple people that I have been talking to of late over the last probably year or so who have talked about this idea of looking at organizations like the fire service, but even the Health Information Management System Society, HIMSS, which is the overarching organization for healthcare technology. And within it, there are all kinds of subgroups, and those subgroups disagree all the time, right? There are, just like political parties, right? Within the Democratic Party or the Republican Party, there are special interest groups that have their own areas of focus. But to the outsiders, it's still the Republican Party, the Democratic Party, the Health Information Management System Society, which has all these underpinnings in different areas people care about. Why does EMS not do that? Why do people have to have this weird loyalty to either NEMSMA or iChiefs or the California Ambulance Association or Cal Chiefs? And like, you can't be all of them because then you're not loyal to any of them. And that tradition and doctrine sense, again, think of it another way. How many of you on this call have ever said, you know, the fire service is 150 years of tradition uninterrupted by progress? Okay, well, that sucks. Or that EMS is the redheaded stepchild or the bastard stepchild or whatever other term you want to use of the healthcare system. And why is it that anybody is going to respect our industry if we don't respect ourselves? Right? So this idea that, like, I mean, I've been told because I'm not a medic that I can't be a member of the American Paramedic Association, whereas I believe I'm probably one of the most vocal advocates for this industry that exists in it. And I've never been a medic, not for one day. So why is it that somebody would try to force me out because I don't wear a patch? So this sense of isolationism and breaking each other apart is something that I think, you know, this group can very much help with. I think all the tentacles that extend from your professional careers, you know, everybody that you talk to is going to agree with some part of what I'm saying here. We don't do it publicly because we're busy tearing each other apart around whether or not we have degrees or whether or not we have, you know, again, what color is your patch, or are you ALS versus BLS? Who cares? That's an internal dialogue, and nobody needs to see that crap on social media or LinkedIn or whatever. They need to see a unified voice of everybody coming together and saying, let's get the job done. So that's one big piece. And I said I'd come back to community paramedicine, but Mike, I'm really glad you mentioned that. But I think in the interest of sort of this concept of breaking apart things, you know, community paramedicine is an interesting example of where there has been a compelling effect of Me Too. And I'm an economics guy, right? So I look at the question of whether, you know, how many people, how many programs of community paramedicine have really taken the time to ask the value question. I gave a presentation that I'd be happy to post and have you guys look at the South Carolina EMS Association Symposium last month, and it was all about this idea that our industry does not measure health. We simply don't, right? We measure pain. We use a pain scale. We measure vitals. We measure distance. We do all these kinds of things, but nobody measures health, right? So are we making our patients better? Nobody measures that. I would argue there really isn't any very good way to measure that, but there are ways of getting close, and none of the three things I just mentioned get anywhere near that. So the question of, are people taking the time, are agencies taking the time to dig into the value proposition so that, again, instead of saying, I need a grant for community paramedicine, or I need, I don't know, some special funding for community, what if somebody said, instead, we're going to get down to, here is the impact we have made on our community, and here is the impact that we have made on these people's lives, and we are going to say, pay us for that work. And whether that work gets paid for by insurance or by an individual's family members because their grandmother now feels better about herself and is healthier, or whatever, if we adopt the idea that we need it to be publicly funded with tax money, which, by the way, gets away from accountability, not moving toward accountability, or if you need to have it based on grant money, which is, basically I'm going to have a tin cup all the time, then neither of those cases gets to the question of value. It sort of skirts around it. And if instead we dug into the data, and the data in the broadest sense, and said, here is the proof that we will bring of the work that we did and why it mattered. And if we do that, and we go to the thing I just ranted about a minute ago, and do it as a unified voice, instead of 7 programs or 6 programs that all get written up in EMS World Magazine, et cetera, instead we said, I'm going to look at as many of these programs as we can find, and we're going to wrap the lessons learned all together, let people talk about the programs you've never heard about but are incredibly innovative, and give them as much attention as Pittsburgh or Mesa, Arizona, or REMSA, or whatever, Dallas and MedStar, then all of a sudden you'd have all these pockets of innovation who can show the value that they've done. And nobody has done that because we're latching on to what came before, and it's the same bit about tradition is the way it was, so let's do it that way. Instead, say, what if we create those traditions? And instead of just saying I'm gonna have what that guy's gonna have, what if we said, let's prove the value, see if that was the right model to follow. And again, I'm not a lineman, so I come at this as a business guy and a data guy, but to me it seems so obvious that the industry needs to have some introspection. And Tony, I think that's what you've done here. If it's not entirely obvious, you've basically said, let's look at ourselves and ask some hard questions. But
Jonathan, and it's not just us looking at ourselves, but we're having somebody like you from the outside, which we're not real good at, asking people to look at us and give us an honest perspective of who we are, and we get hurt feelings because, well, you're not a firefighter, you're not a paramedic, so you don't know us, and you're not part of the brotherhood. Why, as you said, we're tearing ourselves apart. But quickly, what I want to say, I just see this whole value that you've added to EMS now come to the fire side, because we don't promote our prevention and our inspections part and how we are making our community healthier from less fire or less disaster. Yep. Less hazmat incidents or whatever. But that's the right. Police do a great job with it again in community policing. They document and quantify the reduction of crime, which people take as a mental health type of thing because they feel safer in their community.
Well, and I think that's the strength that you're talking. So it's interesting because it's both a strength and a weakness, right? And someone earlier talked about marketing. The strength is that you're doing these things. The weakness is you're not telling anybody about them. Right. Wow. And so the threat is that somebody else is going to pick up your microphone. I mean, let's do the entire SWOT analysis, right? The strength is you're doing all these amazing things that are making the communities better and stronger and healthier and more resilient and so on. The weakness is you don't know how to talk about it. And when people like me who do know how to talk about it get sidelined, well, okay, whatever, we can talk about that. But I don't care. I'm an independent. I'm still going to buff through that and tell the story anyway. The opportunity is to engage a unified voice around a rainbow of patch colors, not just one or two, but to say we're all part of, again, one fraternity of heroes, quite frankly. And that doesn't necessarily mean ripping people out of cars or bringing them back to life, but picking people up who fell down and, helping them through 14 days of infection monitoring. That's all heroic duty, given what we go through. And then the threat is that if you don't tell it, somebody else is going to come along and pick up your microphone and your brand and do it for you. And then you lose control.